y'all, my name is Valerie and I am currently a first semester student at Johns Hopkins doing the master's entry-level program for nursing. To give you some background further on that, I worked as an EMT lab instructor. I've also worked as a physical therapy aide. I've done lots of volunteering in the hospital, and I've done internships in like med-surg ICUs, and so I've gotten a decent amount of exposure even before I came into nursing school, which I really think helped me solidify that nursing was for me and that it was what I wanted. But based on those experiences and based on my experiences in nursing school so far, I thought I would bring some questions for you to consider before determining if nursing is right for you. I feel like a lot of times people glamorize nursing and all the amazing things that come along with being a nurse, but there's also sides to it that people don't really want to talk about. And so I just wanted to give a very quick view of some things to consider before going into nursing and deciding on that career path. First thing you want to consider when saying you want to go into nursing is, why do you want to go into nursing? What is your reasoning behind it? Actually, being someone who's from California, I know nurses get paid really well there, but that's not true for everywhere in the country, and that's something to consider as well, that yes, there are perks, like travel nursing pay is amazing. Depending on where you're going, pay is going to be really great, but then with that comes the high cost of living as well. And so if you're in it for the money, trust me, it would not be worth it. Don't do it. There's so many other jobs and careers that you can look into that pay really well and don't have the same levels of stress. Don't get me wrong, I absolutely love nursing and I feel like it's the right career fit for me, but it might not be for you. Do you have any experiences with nursing? The best way to see if nursing is for you is to see what an actual nurse does. Talking to a nurse, shadowing a nurse. You can do that through volunteering at your local hospital. You can interact with them by volunteering at blood drives. I know that's something I did in undergrad as well. Another great way is getting experience by working in a hospital setting. So you can become an EMT, which you'd work on an ambulance, or you can be an event EMT. You could also work as an ER tech with your EMT license. You could also be a CNA, a scribe, a medical assistant. There's definitely lots of very different ways that you can get experience hands-on with patients and working with nurses while in school, working part-time or full-time. Either way, I would definitely recommend getting some sort of exposure, being in a setting where nurses work, seeing how they interact firsthand, see if it's something that you'd be interested in. That experience is so important because sometimes people go into the program and it's nothing like they wanted. They didn't realize this is what nursing consisted of. It's a great way to first have that initial peak of interest, I guess, and so that would help you see, okay, this is what a nurse does. I'm kind of curious about it. I love what they do. Like, let's learn more. Going off of getting that experience, whether that's through volunteering or through working, another thing to consider about that is, do you have the time or the money to go through with that? Now, nursing, depending on what you do, there's actually a multitude of options that you could consider. You could do an associate's program, a bachelor's program that you could transfer into. You could do an accelerated program after you finish your bachelor's. You could do an accelerated bachelor's degree. You could do a master's degree for entry-level students, which is something that I'm doing. You could even do a master's entry-level program that can have you be an NP, nurse practitioner, at the end of it. So there's a lot of different paths into nursing, and the biggest thing that it comes down to, I feel like, is time and money. And when it comes to experiences, as I mentioned earlier, it's so valuable and so important to get those experiences to really solidify that nursing is what you want to do before you jump into a program. But something to consider is, even with those experiences in itself, those are programs that you'd have to pay for. And so do you have the time or the money to be putting yourself through an EMT program or through a CNA program? They can be pretty costly depending on what you're looking at or how accelerated of a program you're looking at. So look into those options, but know that it doesn't have to be that. Like with volunteering, you're not getting paid, but it's still really great experience and you're giving back to the community, which is awesome. Just to rep my EMTs real quick. So I was an EMT, and I honestly feel like that has helped me so much with my first semester of nursing school. And it's ironic because with our first semester of nursing school at Hopkins, after finishing it, we are eligible to sit to get our CNA license. but I just thought it was interesting because my EMT experience really supported me so much through this and gave me a foundation to build off of that was really valuable. So from my personal experience, I would say being an EMT gives you a really good exposure to what nursing is, and I'm sure CNA is the same as well, but I can only speak for EMT because that's what I've done. So I know we just talked about getting some experience so that you could be in settings where nurses are and see how they work, and that is absolutely great, but it's not always glamorized like it is on social media. The other side to that also is you lose your patients, and that's also a reality to nursing that you have to consider. I know for me, I get really attached to my patients, but learning how to compartmentalize and be able to go and care for your next patient is a really important thing that nurses have to learn. Sometimes those things really take a toll on you, so that's something to consider is, are you able to handle loss and move on? It can be really hard. It's not always this happy side of nursing where you can help people, because sometimes you do everything right and it just isn't enough, and so that's something to consider as well. Nursing school is rigorous. It is very, very difficult. It's very taxing. It takes a lot out of you, and to be honest, taking on nursing school during a pandemic feels like a whole nother thing. Like you're trying to take on a tornado while you're on a roller coaster. It really feels like a lot, and it can be really hard. And so just knowing okay, if you're suffering through something right now, if you're going through something, maybe some time off would be good to make sure that you're taken care of before you go into a program where you are having to take care of others all the time. That is something I feel like a lot of healthcare and nursing students really struggle with, is we spend so much time taking care of other people, but we don't really take care of ourselves. So making sure that you're doing okay and that you have healthy coping mechanisms to get through difficult times, that is so, so important. And it's not to say that a nurse can't be depressed or anxious and not be amazing. Absolutely not. But if you are struggling with your mental health, have you figured out ways to cope to ensure that you're taken care of? Because you want to make sure that you're okay so that you can take care of others. So the fourth thing to consider is, do you know the difference between what a nurse does and a doctor does? And are you okay with the scope of practice of nursing? So doctors are different in that they have a medical diagnosis, and nurses have a nursing diagnosis. And to give you a bit of an example, just personally, I love examples. So a nurse, when they come in, they're very focused on the holistic care of the patient, the socioeconomic factors that may affect them. How is their home life? How is their family life? What is their family history? What is their personal medical history? All these things are very important as to what a nurse does, because they have patient-focused goals and they want to help those patients reach those goals. Whereas a doctor, they have a medical diagnosis and the doctor will treat the disease or whatever the issue is at hand. So my nurse would be concerned about whether I'm able to reach my goals with ambulating a certain distance. My doctor would be concerned about whether my bone has healed properly. My nurse would be concerned about when I would be able to perform certain things and how that would affect my overall well-being, my mental health, my physical health. My doctor would be concerned about would they need a follow-up surgery for me if I'm not healing properly, that sort of thing. Those are some of the differences to consider. Another thing to consider is, do you like to continuously learn? That's something that you have to do as a nurse. Nurses have to recertify every 5 years. Medicine is always advancing. There are always changes. There are always clinical studies being put out that have proof of a new method or a new medication working. You're always going to be learning new techniques, new skills, and so if you don't want to always be learning, maybe this is not the right career for you. Another thing to consider is whether you can think on your feet. As a nurse, it's really important that you're able to adapt to any situation in a calm and respectful manner. Let's say your patient is coding and you're freaking out, you are all over the place, the family's yelling in your face like, what's going on, help this patient. You have to be able to remain calm and know what to do. And that part of that comes with, being a nurse and going through nursing school and getting all this experience and whatnot. But part of it is just knowing if you're able to be quick on your feet. You can't just freeze and be stuck there like, oh my gosh, is this really happening right now? You need to be able to move and do what's best for your patient, and you need to be able to do it in a calm and organized manner. So I think from some of those reasons, you guys can tell that nursing is not all rainbows and butterflies. There are days where it's really hard. We have to deal with burnout, we have to deal with loss, and we have to deal with our own struggles with mental and physical health as well. You need to be able to take care of yourself before you can take care of others. But I think the very last question, and honestly, probably arguably the most important question, is, are you passionate about nursing? Because at the end of the day, if that passion is there, it doesn't matter what other challenges are in your way, you will fight through them. I've seen people who have a fear of blood get through, a fear of talking to people and just being shy, get through, and trust me, if nursing is what you want, you will work so hard for it and you will get to those goals and you will be an amazing nurse. So just know that if things are feeling really hard right now, you're stressed, if you're worried about a bad grade or that you're not good enough, trust me, if the passion and the will is there, you'll do an amazing job. I hope this was helpful, at least in giving you a little bit more perspective on what nursing is and whether it's the right fit for you. I know nursing isn't the right fit for everyone, but sometimes it's just hard to know. So let me know if you guys have any questions or anything like that. Otherwise, hope you guys are having a great week. Happy spooky season!